Good evening, I'm Greg Glover. Thank you for joining us.
And I'm Cindy Sexton.
The measles, a disease we thought was wiped out 2 decades ago, has reappeared and surged to its highest level in the U.S. in 25 years. We're nearing 700 cases nationwide.
Well, the Tennessee Department of Health released new information today on the one person identified as having measles in this state. Health officials want to warn anyone who may not be vaccinated that the contagious person was in 2 locations in Tennessee and may have spread the virus.
Most physicians and people in the population have never even seen measles, and that's because the vaccine has been so effective.
But the disease is highly contagious. State epidemiologist Tim Jones is clear in his message.
Measles is one of the most infectious diseases that we deal with. It's very, very easy to spread, and it's airborne. So it's spread by basically coughing, sneezing, even breathing in a room.
Which is why state health officials released the names of 2 locations where the person infected with the measles was known to be. One, the Mapco gas station on Browns Ferry Road in Chattanooga. Officials say the infected person visited that gas station April 11th between 7:30 and 10 in the evening. The second location is about 100 miles northeast in Clinton, Tennessee. The person went there the next day. The health department says that person may have come into contact with some 600 people. It's important to get this information to the public. Unvaccinated people who may have been exposed could be seeing symptoms now.
So this can start out almost like, the flu or a bad cold with runny nose, fever, watery eyes, and it's generally a few days later that the classic rash develops.
It's also important to note it is now safe to go to the 2 gas stations noted.
So once the air is settled, establishments are no longer a risk. So we generally say that once a person is out of a room for several hours, there's no longer any risk there.
But if you are experiencing symptoms, contact your doctor or the health department. State health officials say they will definitely notify the public if there are additional cases that could put others at risk.
Tomorrow, Dr. Charles Woods, Chief Medical Officer and Infectious Disease Specialist at Children's Hospital at Erlanger, will be answering questions about measles and vaccinations. He'll reportedly provide general information about signs and symptoms of the measles, how the disease is spread, and what the health risks are to patients.